This is one of those times that there's good news and bad news. The good news is I know a lot about this contract, and the bad news for GSA is I happen to be from Missouri and chair this committee. So it is an easy one for us to do a case study of. But I want to say at the outset, I perfectly well understand that this isn't a problem that is just GSA's. And I perfectly well understand that the problems we're going to talk about today in contracting apply to every federal agency. And it just so happens that this is a perfect, manageable size contract, and we can do the timeline of exactly what happened, and I think it will be illustrative to other federal agencies that this is not the way you're supposed to contract. This is not the way it's supposed to be done. And hopefully we will learn from this and other federal agencies will pay attention. Let me start with this. Ms. Johnson, did you do anything wrong in this contract? Did GSA do anything wrong?
Used to this. We did nothing wrong with this contract.
Mr. Peck, did GSA do anything wrong in the way they issued this PR contract?
We did not do anything wrong with this contract.
Okay. Bad start. You had 8 individuals, including the individual responsible, who were at a GS-13 level or higher. You know, that is a serious payroll for your agency in terms of public affairs specialists. So do you think, looking back on it, that crisis management should have been part of the core competency of, I mean, most of those are senior executive. They, I think, enjoy not only 6-figure salaries, but most of them get bonuses approximating 10% year in and year out. Shouldn't all of our staffs that are hired to handle the public affairs of our agencies be ready to handle crisis management, even explaining technical issues in layman's terms?
Senator, I have to say, from my tenure in the 90s to my current tenure, there is a great deal more media interest in what we are doing. And I would agree that going forward, it would be significantly useful to have people with those kinds of competencies.
I think it's important to the people at work at Bannister that there now have been dozens and dozens and dozens of tests that have been performed, none of which have indicated a health hazard to the employees and families that work at Bannister and their children cared for at Bannister. But the issue here is not whether or not it is safe today, but how GSA handled the challenges of dealing with the questions about the safety at Bannister. As it turns out, this contract for 3 months, if you extrapolated it out over the life of a year, would have been $1 million contract. This is exactly the kind of thing that allows the public to get deep-rooted cynicism about the way we spend money. And finally, I would just say accountability. If we now acknowledge at the end of the hearing that mistakes were made, then I have yet to see where anyone was held accountable for those mistakes. It's interesting to me that I'm not aware of anyone who suffered any kind of accountability because of the mistakes that were made surrounding this contract. That's troubling to me. I don't think that would happen in the private sector. And I think it's important that we demonstrate to the public that when mistakes are made, that someone is held accountable. And I'm not convinced that that's the case in this particular contract.